The orientation process was absolutely phenomenal. It was rich, full, drinking from a fire hose.
We all come to Washington, D.C. If you were me, you were pretty wide-eyed and bushy-tailed. Hadn't a clue how Washington, D.C. worked. Not a clue. Most of us were pretty well trained in certainly the clinical side of healthcare, but very poor understanding of the role and the importance of the federal government in shaping how we deliver healthcare in this country.
I believe only with the prestige of this program are they able to put together a 3.5-month orientation where you're hearing from all the leading people in healthcare. Essentially what you're doing is cramming in a semester or probably even 2 semesters of content into 3.5 months, which is a little bit over 14 weeks.
Let me tell you about my orientation during the fellowship. And I walked into the room and here's my class, if you will. And we've got doctors and we've got very accomplished individuals, some that had far more policy expertise than I have to be honest with you, it was overwhelming.
I had not been in school for quite some time. And so being in a classroom with no windows and sitting there for 8 hours was it was an adjustment for me.
For somebody who'd been the professor for so long, to be a student was like a joy, and that was your responsibility. Having the opportunity one-on-one with, various agency people and lobbyists and the whole range of people who populate the political process was, really, really interesting.
It's a really unique experience to be sort of stepping out of that career-minded, what am I doing, what is the next step for me, and to be placed in a new city with new sets of experiences and sort of a time to think. And the best part of that is that you're connected with a handful of other professionals sort of experiencing the same thing.
When you're stepping into this space, you're stepping into it from an outsider's perspective. And so gaining that inside perspective of the people who are doing this on the day-to-day is essential in being effective. And especially as we go into our placements, it's even more effective having that network of folks and those experts to reach out to when you're looking into these health policy ideas and trying to pass legislation.
I came from family medicine, a very different world. I was still learning acronyms, CMS, CMMI. These people were giants. They were legends, and they were so glib and so fluent in their areas. And I think I was in awe and inspired by their expertise.
You can learn how advocacy works. You can learn how policies are formed, how are they framed, what are the negotiations that people go through. And so learning about the whole process is pretty valuable if you're going to have any kind of impact on other policies that influence health once you leave.
I think my favorite part of the orientation was the political science piece because that was totally new to me. And so I really enjoyed just learning about electoral politics and voting and the different ways that the dynamics can play out in a legislative body. That was all really new to me and was one of my favorite parts.
You're hearing from agency leads, we're visiting agencies, all the think tanks, obviously, Brookings, Cato, AEI, across the political spectrum.
Meeting with everyone from every sector, the Congressional Research Service, learning about how legislation is made, meeting with all the players, folks in the media, folks with different agencies.
Meeting with people from key reporters, policy wonks, the people that you read about or you see about on the news who talk about policy, who are experts. We got the opportunity to be exposed to that caliber of leaders. It was absolutely outstanding.
We do get to meet individuals on both sides of the aisle, individuals that have a whole variety of beliefs. So we meet people with diversity of opinions and thoughts on a whole variety of issues.
Our fellowship group, I have a picture of us with Secretary Shalala when she was Secretary of Health and Human Services. And so you're meeting top officials, both in the public sector, but also in the private sector.
And I remember remember in particular Gail Walensky giving a talk on health economics. She was one of many, and then there were the American Hospital Association and various health associations, which I hadn't understood their role at all in the environment.
I think that meeting with the think tanks is probably the most interesting to me. I mean, I know we're supposed to be kind of strictly nonpartisan or bipartisan, but some of the political thoughts on both extremes are just both interesting and entertaining.
You're learning about their perspective, their views on the various health policy issues, but also how they package their career. And that's what fascinated me, all the different paths that people take to become someone that works on policy in this town.
I think, for example, they really took advantage of this wonderful orientation to network with people and kind of get a broader perspective on how Washington worked.
Everybody was so welcoming, and it took us a little while to figure out why these famous, important people were so nice and welcoming to us. It's because they knew we didn't know anything, and they knew we were going to be in these key positions in key offices.
When we were in our offices, we knew who to call. We knew where to get information, because when you end up in the offices, you'll be asked to do things that you may not know how to do, but you'll know how to get the information to do it.
You got to meet all these people who were experts in different parts of health policy. And then you called on them when you were in the office, and that was invaluable.
I still draw upon those resources. I still draw upon that knowledge, because over the years it started to click for me.
I still know people that I met on that orientation, and that's 25 years later. These were leaders in healthcare and health policy, or future leaders in healthcare and health policy. It's paid back in spades as I've gone forward and others have gone forward with their careers.